Hello everyone, this is Dr. Neeraj Pandey, dermatologist. I own the chain of skin clinics called Derma Clinic, Skin, Laser, Hair and Research Clinic, one at Gomti Nagar and one at Hazratganj. I am into practice since last 15 years. And today my topic is to talk about hair loss, which is quite prevalent nowadays, and we are getting more aware about this. I'll start with female hair loss. The females are more considerate about this, and diffuse hair loss is a term when we give it when the hair loss is more than 100 per day. It's said to be diffuse hair loss. Then there is female pattern baldness, which is more of a genetic pattern of baldness aggravated by so many other co-conditions, so many hormonal, which most common causes for diffuse hair loss, or the trigger in female pattern baldness or the genetic pattern of baldness, or which we say a specific pattern of hair loss, is are hormonal causes like thyroid imbalance, like hypothyroidism. Then there is PCOD, ovarian cyst, and other hormonal irregularities, anemia if your hemoglobin is low, vitamin B12 deficiency, vitamin D deficiency. So these are the major causes, and the stress is one of the bigger causes. Then change of place, of late people do complain. The change of place sometimes induces, but it's not a very big cause. These causes should be certain when there is more than 100 per day, when the hair loss in females specifically more than per day, then you should visit your dermatologist and let him decide what will be the ideal treatment for you. If it is post-pregnancy, sometimes it's known as telogen effluvium or diffuse hair loss, and that has got a specific time period. Within 2 to 3 months it's get back to normal, but yes, doctor intervention is required. So he will decide what micronutrients or what treatment to be given. There are specific treatments for hair loss, whether it's male or female, like medical treatment. Medical treatment consists of, again, it's in the jurisdiction of doctor what you want to decide as per the grading of your hair loss. Then secondly, there are few procedures which are of late proving to be excellent tool to check hair loss and reinduce hair growth, like PRP, platelet rich plasma, like mesotherapy for hair loss, stem cell therapy, and where in some cases of female pattern baldness they demand hair transplant. It's again the final decision is with the treating dermatologist. The causes we have already ruled out what to be seen when there is any diffuse hair loss more than 100 per day, right from thyroid to hormonal irregularities and anemia and stress level. Then the one more important history which should be asked to each and every patient, specifically females: are they dieting, are they on crash diet? That induces diffuse hair loss too. And then I'll talk about male pattern baldness, or known as androgenetic alopecia technically. This is a genetic pattern of hair loss which it has got a specific pattern of hair loss. Your hairlines recedes, and the grading is given as per the receding hairline, right from grade 1 to grade 7, and accordingly the treatment is decided. There are approved treatments like minoxidil, finasteride, and there are other supporting treatments like biotin. It depends what treatment to be started, and it's started after a proper thorough clinical examination and after a few investigations which are required to be done. So the final decision lies with your doctor, the treating dermatologist. Similarly, of late I am seeing the hair loss complaint is increasing in teens, in children also. So again the causes are different. When there is diffuse, there is only one message: when their hair loss is more than 100 per day, you need a dermatologist to certain what is the exact cause of this hair loss, and that accordingly it should be treated. The trigger should be removed, then the treatment should be given. And there are the advice will be this: there should be a proper diet. You should not go on crash dieting, protein rich diet, like then vitamin C rich fruits, egg, and diet as per the doctor advice. Stress should be avoided. Vigorous shampooing should be avoided. If you are going for parlor treatments like hair spa and other hair straightening, then this should be avoided during diffuse hair loss. It doesn't suit everyone. So hair loss is not a very complex science, but yes, when it's more than 100 per day, I'll suggest that do visit your dermatologist, let him decide what's the best treatment. Thank you. And there is a request, if you like this video, please do share it, and like it if you are feeling that the content is going to help you. Thank you very much. I am signing off. Your own Dr. Neeraj Pandey, Derma Clinic, Skin Laser, Hair and Research Clinics. Thank you.